Hello and welcome. I am Melissa Long and the Director of Education and Support at Insight Memory Care Center. Today, we are talking about managing primary progressive aphasia, and I would like to thank AARP for sponsoring this event with us. I have put in the chat a link for a survey so that you can share a little bit about this presentation and learning about us. Our presenter today is Will Reiter. He is the Association of Frontotemporal Lobe Education Program Manager. And I'll give you a little bit more about him in a moment. Just go through some housekeeping things. We will be recording this. You can look at it later. We also have the Q&A box, and I ask that you put your questions in there. And we'll do most of the questions at the end, but Mr. Reiter might at some point stop and ask if there's any questions, and we might be able to answer them for that piece as well. Our mission here at Insight is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, their partners, and the community. And our vision, a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. So Mr. Reiter has worked in the dementia field for over 25 years. He initially trained as a music therapist at Temple University. He's a strong believer in the power of music to connect with and engage those living with dementia. Following a master's degree in gerontology from San Francisco State University, he provided education and support in a variety of local and regional settings, teaching better care strategies to family care partners and healthcare providers, as well as speaking to the general community about dementia risk and the importance of brain healthy lifestyle. Currently, as an education program manager at the Association for Frontotemporal Degeneration, he strengthens relationships with medical clinicians and professional care providers to expand the awareness of frontotemporal degeneration and increasing the early diagnosis and access to quality care. AFTD envisions a world with compassionate care, effective support, and a future free of FTD. So thank you so much, Mr. Reiter, for being with us, and I'll let you go ahead and share your screen and take over.
Thank you, Melissa. Thank you for inviting me to speak to your audience today, and good afternoon, everyone. Thank you for joining. And as I talk, I am going to share my screen. And I'm hoping, Melissa, can you see my PowerPoint?
I can. You just need to switch to presenter mode and you should be all set.
Okay, and I also need to go to the beginning. Is it in presenter mode now?
It is. You're all set.
Great. Thanks so much. So hello again. As Melissa mentioned, I work for the Association for Frontotemporal Degeneration. We are a national nonprofit that supports people who are living with FTD, either persons with an FTD disorder or their care partners or caregivers or family members, but also provide information and education to clinicians who are in the detection, diagnosis, clinical care world, as well as professionals that work in the dementia care world. I'll talk a little bit more about AFTD and what we offer towards the end of the program. You can see here my name, my title, and my email if for any reason you want to get in touch with me after the program. And then at the very bottom of the slide, the www.theaftd.org is our website. That's our main page. And there's a lot of in-depth information you can get to and travel through by going to that page first. After that is our helpline number, 1-866-507-7222. One way to reach us, if you want to talk to one of our helpline specialists who are all, master's level social workers and who take calls from individuals with FTD, from families, from professionals who work with folks with dementia. And it's a Monday through Friday, 9 to 5 East Coast time helpline. but we certainly respond to people who call us after hours and over the weekend. And typically, we're able to respond to someone, within 24 hours, or if it's on a Friday night through the weekend, sometime on Monday or early Tuesday. info@theaftd.org is our email helpline. So that's another way to reach out to us to get information. So Melissa shared that I've worked in the dementia field for quite some time, about a little over 3 years at AFTD. And I must say that as someone who's worked in dementia care way back when I started, I knew a lot more about Alzheimer's disease and just a bit about FTD. And so hopefully I'll be sharing, if you work in the field, some new or more expanded information about primary progressive aphasia and how it's part of the FTD spectrum. And if you're caring for someone, and this is not a new diagnosis, or a person living with primary progressive aphasia, there'll be some bits of information that can help support you along the journey of primary progressive aphasia. So what am I going to talk about today? So these are the 3 basic topics, and I will probably take a break after them. So as Melissa said, encourage you to type in any questions you might have along the way, because when I stop, I'll be looking to Melissa to pose any questions that have come in. And certainly, I believe there'll be time at the end to cover questions also. So I'm going to start off with a brief overview of, what is frontotemporal degeneration? How is PPA part of that family of disorders? And then more specifically, some information about primary progressive aphasia. Again, if you're somebody that for whom this is a new diagnosis, or a professional caregiver that has not worked a great deal with people with primary progressive aphasia, hopefully some of that specific information will bring some greater light and understanding. Then I'm going to talk a little bit more about ways to foster better communication, whether you're a family caregiver or a professional caregiver. What are some strategies that seem to help for better understanding, better clarity, reduced frustration? And then I'm going to close with my overview, really, of AFTD. Who are we? What are the various supports and services that we offer? Many of which we find are of value to families living with or caring for someone with primary progressive aphasia. So that's the basic idea. So just to kind of get us on the same page, FTD is a cluster of complex disorders that are under that umbrella of frontotemporal degeneration. Some out there in the world, some organizations use the term frontotemporal dementia. Sometimes you might hear frontotemporal lobar degeneration, and that's more commonly a term used, let's say, by researchers or academic medical center clinicians. And then you may have even sometimes heard the term Pick's disease, which I would say is a more historic term related to FTD, is not used as commonly now, and it really relates to a specific subset of FTD, not the broad spectrum of FTD. So when we look at FTD, and this is one of the challenges of FTD and primary progressive aphasia being part of the spectrum, there are some things that are quite different from, let's say, Alzheimer's disease. So first of all, you may already be aware that FTD is often called a younger onset type of dementia, which means that people who are diagnosed with PPA or, let's say, behavioral variant FTD, the age of onset is typically or more often in the 30s, but more often in the late 40s through the 50s, the early 60s. Now, people do develop the FTD disorders earlier than that. There's certainly a record of a person as young as 18 being diagnosed with an FTD disorder, and people do develop FTD, in their later years. But when you contrast that with Alzheimer's, which it typically has a later onset, there are certainly people with Alzheimer's disease that develop Alzheimer's symptoms and are diagnosed before 65. That's called younger onset Alzheimer's. It's not typical, so it's a smaller percentage. Let's say 2 to 4% of all people with Alzheimer's start to show the symptoms and are diagnosed before 65, whereas it's more typical or common for people to start showing an FTD disorder at a younger age. The other thing that's also different is the symptoms for someone with FTD. And on the left-hand side, you'll see primary progressive aphasia, which is what we're here to talk about today, which primarily starts with the early symptoms being challenges, problems, or difficulties with communication, either expressive communication or comprehension, understanding communication. In the center is behavioral variant FTD, where the initial symptoms are primarily pretty, specific and stark changes in personality or behaviors like disinhibited behavior or, problems with executive function. And then on the right hand, you see the lesser common FTD disorders, which primarily start with symptoms that are challenges or issues with movement. And those are cortical basal syndrome, progressive supranuclear palsy, and FTD and motor neuron disease, which unfortunately is when a person develops and is diagnosed with both an FTD disorder and ALS. But the one symptom that's not typical or common with an early warning sign is the kind of forgetting, the short-term memory forgetting that's part of Alzheimer's. So the early changes are less about forgetting what you had for breakfast or that your daughter visited yesterday, but more changes in speaking or understanding language with PPA, changes to behavior with behavioral variant FTD, or difficulties or problems, with movement with the progressive motor disorders. And part of the reason for that is where these FTD disorders start in the brain. With Alzheimer's disease, the development of those things called beta amyloid plaques and tau tangles, one of the focal areas is something called the hippocampus, which I think of as sort of like the filing cabinet of the brain. It's one of the primary areas of the brain that helps us to store, code, and organize new memories. So with Alzheimer's disease, that hippocampus is where that neuronal deterioration begins and expands outward. With FTD disorders, typically the focus of that neuronal deterioration or brain nerve cell damage is either in the frontal lobes, which on this slide you can see is the blue part of the brain on the front side of the brain, and that aspect of the brain controls a lot of reasoning and impulse control, initiation of behaviors or activities, solving problems, and executive function, which I think of as, being able to manage a task or activity that has multiple steps, that takes place over time. There's a certain amount of planning that one has to do, and you have to do the steps in the right order to do that activity. I mean, a general day-to-day activity that's a good example of that would be like baking a pumpkin pie for Thanksgiving. You have to have control over all of the steps in order to be able to succeed in that activity. If we look on the right hand of the slide, the temporal lobes, and here this would be the left lobe because it's on the left side, that area has a lot to do with communication. So, inhibition of speech, understanding and interpreting visual memories or pictures or faces on the right lobe, and then the left lobe in terms of verbal memory or comprehending words or names, and potentially sorting new information. There certainly are communication functions that happen within the frontal lobe, so it's not quite as distinctly separate as this slide is depicting, but this is a generalization of those two areas. And in fact, this is where the name frontotemporal degeneration or FTD comes from, is these two parts of the brain are often the focal point, either one or the other or both, with a person who has one of the FTD disorders, including primary progressive aphasia. So let's talk a little bit about primary progressive aphasia. So first off, I just want to acknowledge that, aphasia is certainly a medical term or descriptive term that doctors use when someone is exhibiting an impairment with language or communication. It's not, I would say aphasia is not a specific disease in and of itself, but it's a descriptive word that physicians will use to describe changes or problems with communication, but that can be caused by a variety of things and can happen for a variety of reasons. And that can be something that's quite abrupt and severe, like a stroke, which is, a brain event which happens in a particular moment. And a person with stroke, the resulting difficulties post-stroke can be aphasia or aphasia symptoms. But that abrupt incident, a stroke, an acquired brain injury, a traumatic brain injury, in and of itself, if it causes aphasia, would not necessarily be diagnosed as a primary progressive aphasia, because primary progressive aphasia are problems with communication that are brought about by a neurodegenerative process that takes place over time. So with PPA, it's problems or issues in communication that start to occur because of something that's happening in the brain, typically slowly, and over time expands, and the symptoms become observable either to the person or family members at some point because of changes in communication between two people. Something's going on here, and then a person goes in for a clinical assessment. That's different from an aphasia brought on by some attack or some event. Um, it is true, on the other hand, that a person who has, let's say, a stroke, because of that, they may be more likely to, at some point, have a process that would take them down the road of a neurodegenerative deterioration, but that's not always true. With primary progressive aphasia, the disorder, which is neurodegenerative, is what's causing the aphasia, and it's called primary progressive aphasia. So I'm going to take a sip of water, and I think now I'm going to just spend a little time talking about the three subtypes or variants of primary progressive aphasia. And I want to acknowledge that often people that get a diagnosis of PPA, that's the diagnosis that they get, and that's enough for they and family members and supporting clinicians to create a plan of care and to help to put in place supports and mechanisms to enable them to live successfully and to face challenges as they come until maybe another assessment is needed. But in some settings, in certainly academic medical centers or maybe centers that specialize in primary progressive aphasia, people are also given a particular subtype diagnosis. I'm not here to say that everyone, it's important that each of us, if diagnosed with PPA, would get a diagnosis about the subtype, but it does happen. So the three subtypes of primary progressive aphasia are non-fluent agrammatic, semantic, and logopenic. And they are assessed clinically by a doctor or generally by a doctor in terms of what are the early symptoms, what's being exhibited. In a broad general sense, non-fluent agrammatic, one of the more common early symptoms are people over time start using telegraphic speech. So that means that they'll be describing something or talking about something, but they start to leave out the shorter connecting words. Like instead of saying, like they looked at a picture of a family, two parents and children walking in a park towards a lake, asked to describe that picture, they might say, mom, dad, children, walking, lake. So like all of the connecting words are not included and get left behind. And also part of their speech, articulating words and phrases becomes more difficult. So the speech may become halting and the person may have trouble, but it's not, the difficulty with articulating is not caused by a lack of muscle control or muscle strength, but is caused by the cognitive components of connecting those words and speaking those words. If we move on to semantic, in a broad sense, with a person who's exhibiting the common symptoms of semantic PPA, the person will often have an inability to recall names of objects. When shown a picture of a truck, they might not be able to use that word, or if they were a cook or a chef, someone raises a spatula and they can't come up with the word, even though it's something they may have commonly used. And there can also be challenges or problems with comprehending words or language. Now, both non-fluent, another one of the complexities of PPA is both non-fluent agrammatic and semantic PPA are more often caused by FTD deterioration. Logopenic, the third type of PPA, or the third variant, is actually more often caused by Alzheimer's deterioration. So those beta amyloid plaques and tangles that are such tau tangles that are such a hallmark of Alzheimer's are what's causing the logopenic PPA, but it's focusing in those areas of the brain that I talked about where FTD is typically occurring. And with logopenic, again, people have difficulty finding the right word or pulling the right word out of memory, and they also have difficulty with repeating phrases because there's a problem with kind of remembering something they were told and then repeating it back. Are these distinctions always crystal clear? No. And so again, whether a person gets a specific variant diagnosis doesn't necessarily always guide the care plan. It's most important, as I'll talk about, for the clinical team as well as a speech language pathologist to be involved to assess what are the best ways to maintain good communication between the person with FTD and their family caregiver. I think that a few other things I will say about primary progressive aphasia and in particular the spectrum of FTD disorders before I stop to take a break. And that is, I don't have slides on this here, but I would encourage you, if you're interested, the FTD disorders, another distinct difference, let's say from Alzheimer's disease, is a higher number of people who are diagnosed with an FTD disorder, so primary progressive aphasia and behavioral variant FTD, a higher number of people, there can be a genetic causation. So an autosomal dominant caused disorder. And when I say more, what does that mean? So about 50% of people that have a diagnosis of FTD, there's no known genetic relationship. I'm sorry, I should 60%. No known genetic causation found upon further research. For those other 40%, people with an FTD diagnosis, including PPA, have some kind of neurodegenerative history. It may be another FTD disorder. It could be primary progressive aphasia, or it could be something else, ALS. And then in about 20% of people that are diagnosed with an FTD disorder, again, including primary progressive aphasia, there can be a genetic relationship to FTD. So we encourage people to always learn more about the genetics of FTD, and you can find out more about that on our website or by calling our helpline. It's helpful to know what genetic risk there is, and then to determine whether there's any further investigation to be done. So I will stop there. So Melissa, I don't know if we want to, are there any questions that you want to pose at this point?
There is one from Carol, and it says, is PPA more likely to be expressive rather than receptive?
So I would say, So I would say it depends on which type of PPA variant a person has. I would say it's a mixed bag, and I guess I've never actually seen that question answered. I think that in general, the FTD disorders are rarer. So about 60,000, roughly 60,000 people in the US are diagnosed currently with an FTD disorder, although we know that that's probably not an accurate count because of the challenges to getting an accurate diagnosis or the likelihood a person has a mixed diagnosis. I think that so more research needs to be done. With those 60,000, half of those people are diagnosed with BV-FTD, and PPA is the next most common type of FTD. Certainly, if we look at this slide, people who are showing the signs of semantic PPA are going to have more difficulty with comprehension and understanding, and people with non-fluent agrammatic are going to have more challenges with expression. I think another compounding issue with do more people have problems with expression or with comprehension is, as within any neurodegenerative disorder, the symptoms of any one person kind of depends on when they're diagnosed, right? So as the disease progresses, certainly someone who has more challenges with expression might begin to have challenges with comprehension as the disorder progresses. So I think that's the best answer I can give in the moment.
Perfect. Thank you. And the other question we had, you actually answered while doing this slide. It was, is logopenic PPA considered FTD or Alzheimer's? But you beautifully answered that, so I didn't have to bring that one up.
Well, good. I love it when I beautifully answer something. I think it's not, that's a good question because it isn't, I think, out there in the world of Alzheimer's and the general information about Alzheimer's. There's not as much shared about logopenic PPA being caused by Alzheimer's because, again, it's rarer in comparison to the majority of people that have the beta amyloid plaques and tangles. But of course, rare doesn't mean it's not critically important or challenging for the person with logopenic and their caregivers. So I am going to move on then. And now I'm going to talk a little bit about some guidance that we provide in terms of some of our written information about like strategies and approaches for, how, in particular, family care partners or professional caregivers can help to create an environment where there's easier communication, better comprehension, hopefully less frustration, and an opportunity to like figure out how to step away and out of a frustrating situation and maybe come back at a later point. And before I do that, I just want to give another plug for speech language pathologists. And we do, later in the presentation, I am going to highlight and talk about a webinar, an AFTD webinar that you can access via YouTube, and I give you the link. It's a speech language pathologist a PhD speech language pathologist who spoke at our annual conference last year, Maya Henry, and it's really an excellent discussion around speech language pathology and approaches to better enable communication. And one of the things she also talks about is it's surprising how often people that are diagnosed with PPA don't get referred to a speech language pathologist. So if that is your situation, I think that certainly when a person is newly diagnosed, we would say that a speech language pathologist is critically important for that initial assessment and ground setting. And so that's something to always keep in mind, because along with the clinical diagnostic and care team, a speech language pathologist is accustomed to and used to creating personalized plans of care to address problems with communication between an individual and someone else. It is true, I think, that probably speech language pathologists do a greater level of work with people that have had, like an example, a stroke and need to work on communication, and the focus of their work is helping the person regain skills, so to re-educate, to retrain muscles or brain cells to like adapt and to learn and grow. And in fact, that can be part of the approach, but isn't the primary approach with someone with a neurodegenerative condition. And so they're more used to billing for things that show a continued improvement and then stopping when the person reached a plateau. But they can and are able to work to create plans to maintain or maximize communication, and they do that through communication tools, devices. In my work with people with PPA and better understanding it, they can help to create lists or scripts that the person with PPA and their family or care partners can practice and use. So having go-to words or phrases that the person can learn to use and then continue to use for a period of time to make sure that there are ways to, actively engage, to communicate between two individuals what are the most important needs, and so on. At the bottom of this slide I wouldn't call these things rocket science. I mean, these are general communication strategies that are true and often true of any person who has a neurodegenerative illness. So I know that my father, who I provide care and support to, who has Alzheimer's dementia. He also is hearing impaired. That it's critically important that the television isn't on, the radio isn't on, that we're not meeting or talking in a room where there's a lot of other noise that could be distracting or bleed into the very challenging conversations we're trying to have. Another approach is certainly there's so much about the face and nonverbal communication that it's so critically important to have eye contact and facial contact. I think it's probably true as well that talking to someone with PPA from behind them or off to the side or not in their visual space, you're losing out on a very key component of communication. And boy, do we all learn have to speak slowly. I tend to speak kind of fast and then slow, but I know that speaking slowly in short phrases, allowing time for response, and I feel like I was fortunately born with a good bit of patience, so I'm able to wait. I'm able to be patient. Not all of us come with that in our toolkit. I think it's a great skill and ability to have, and it's certainly true in terms of communicating with a person with primary progressive aphasia. And I think that's also true for the person with aphasia in terms of them having patience and allowing time for the care partners to, for the light bulb to go off, for understanding. Compensatory techniques such as, cueing and hand gestures, and certainly repeating, clarifying, describing things in short phrases is so key. And another guidance is it probably is generally always true. Caregivers sometimes or care partners want to, you just fall into the trap of kind of pretending that you know what's being said or what's being communicated in from the perspective of you want to make the person feel better, and you want to help the person not feel bad about the difficulties. But in fact, in general, it's true that if you don't understand, if it's not clear, it's not helpful often to act like it is. So, I mean, my approach in that situation is, you try really hard, you try things in different ways. I think when providing support to a person with communication challenges, part of the approach always has to be, is there a different way to say that, not using a lot of words, or a simple question that I can ask before maybe you take a break and say, you know what, I'm not understanding. Let's see if we can take a break and go in and have a cup of tea. And maybe sometimes just the change of environment can clear things up, or maybe that whatever isn't important. Sometimes that's not possible because the person it's very important to them and they're very focused on that. But sometimes it is possible to do a reset. And that reset can even help to make it easier to get back to that original question or issue. In the middle stages, again, speech language pathologists can help to develop scripts. Or, I mean, I think what's interesting here when we talk about the middle stage of primary progressive aphasia is that sometimes caregivers and families, especially care partners or members who are not the primary caregiver, may have difficulties with thinking about, well, like, how are we going to talk, or what are we going to talk about, or they're not in the day-to-day modus operandi of communicating. And these activity scripts can help to start a conversation. Not that you're always going to talk about or communicate the same things to each other, but it gets you to that doorway about talking about an important topic or activity for the individual with primary progressive aphasia. So this next segment, simplify questions and directions, is really about at the this point in the disease. And you might ask, well, how do we define early, middle, and late? And I think that's a question better directed to the clinical team. When the regular annual assessment is done, they would have a better sense of, where is the person on the trajectory of primary progressive aphasia. Certainly in the middle stage, communication between individuals has become much more challenging, and it's more about, having simplification of asking questions. The whole concept of asking and answering a closed question rather than an open question is easier. And here are clear examples of that, which are, instead of saying, what do you want to have for breakfast, you're asking about a choice between coffee or tea. Or what do you want to have for dinner, or where would you like to go for dinner? You might be asking, what are you up for tonight? I'm thinking maybe pizza or pasta. Like you're giving a choice, and then they can make the selection, but it's limited in terms of the scope of things that they're choosing from. And I'll mention at the bottom of this slide, I'm not sure I said this earlier on, but for persons with primary progressive aphasia and any of the FTD disorders, over time, individuals who started with primarily communication symptoms or challenges, some individuals, as the disease progresses, will potentially start exhibiting behavioral symptoms or movement symptoms. And again, I'm not aware there's extensive research on, the percentage of that or what's more common, but it does occur. And so it's good to know that if there's, new symptoms that don't really fall under the category as defined by primary progressive aphasia or your diagnostic team, that's the time to advocate for another assessment. And certainly if it's behavioral, a neurological or a neuropsychological assessment. And in the late stage of PPA, certainly, communication is much more limited in terms of, fewer words, certainly needing to rely on visuals much more, such as gestures or, writing, if that continues to be an area of communication that's understood, or picture boards might be more likely to be used in this area. And, checking in on things, asking more, the caregiver asking more questions that are able to be answered with a simple yes or no. Are you feeling any pain? Are you in any discomfort? Show me where that is. Are you, hungry? Are you thirsty? I mean, being very specific with the communication, but keeping it simple. And then also in this later stage is, again, with changes where a doctor making a referral for a speech language pathologist assessment, and they also would be one of the specialists that would be involved in assessing for any swallowing issues or difficulties. And I think this is my last slide before I talk about AFTD. So this is really just giving you a perspective on, in terms of, AFTD, what we see as some of the core services that we would hope are available in your area in terms of specialists who could be pulled into your team or referred to by your primary care doctor or your neurology specialist. Certainly, I'm not going to go into any specifics, but an elder law attorney in terms of, and this should be done earlier in the disease as opposed to later, in terms of the legal documents being in place, such as the power of attorney for finances and healthcare. Palliative care is a type of specialty care that's becoming more common, but not common everywhere. It's often associated with hospice, but palliative care does not have to be provided only during hospice, and is something to potentially investigate. I mean, palliative care is care that helps the person be comfortable and have improves quality of life, but it's not about treatment for a specific disease, but strategies and approaches that can assist in, again, quality of life. So I am going to stop there again, Melissa, and see if there's any new questions.
Yes, we have one from George. Can intermittent but chronic verbal enunciation issues, clear cognition but not speaking clearly, be indicative of PPA?
Hmm. Say that one again.
Can intermittent but chronic verbal enunciation issues, but having clear cognition and not speaking clearly, be indicative of PPA?
So so I would say the periodic enunciation, that was the first thing you said, right? So these are
Yep.
these are not terminologies that so I'm not a medical doctor and have more of a social work background. So some of these words I want to just clarify what I'm thinking they mean. So go back to the enunciation. Periodic enunciation.
The chronic verbal enunciation
uh,
issues. So basically what they're saying is this person has clear cognition, no problem, but not speaking clearly. Is that indicative of PPA?
So I would say in general, I would say that I would agree with that. In that um, there's kind of a question out there. Do people with primary progressive aphasia have dementia or not? Because uh, early in the disease process with primary progressive aphasia, memory problems are not typically, like, setting aside the logopenic variant of primary progressive aphasia, for people with semantic and agrammatic um, memory memory challenges are not the issue. It's uh, speech production, which again is not, the problem is not muscular, but it's producing speech um, from a cognitive sense. That's that's the exact example of one of the variants of PPA. So does that answer the question? I think so.
I think so. If not, please let us know in the chat.
Yes, you may know more than I do, but that's the way I would answer it. I mean, so a lack uh, um, of memory is not underpinning. Now, comprehension is another thing. So when I talked about um, not agrammatic but semantic, there are some challenges with comprehension, like understanding what a picture of a word, like what it is or what someone says. But the 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 remembering things is not typically a part of it. Okay, so I'm gonna move on and go ahead, and the person who asked that question, if they have more to say, I'd invite them to do that. And we'll try to come back to that. Okay, so now I'm going to talk a bit about AFTD. And now hopefully, unless you know AFTD well, there will be something that I share that's of value to you that you want to pursue. So AFTD, the Association for Frontotemporal Degeneration, we're a national nonprofit. We've been in existence for over 20 years. We don't have chapters across the country. Like if you think of the Alzheimer's Association, they have physical offices in the different states. We grew up and started in the greater Philadelphia area, which is where I currently am, and many of our staff live in that regional geographic area. But we get calls from people across the country. We get emails from people across the country. We have a number of support groups that take place in person that are volunteer led. We have volunteers that go out and do in-person talks. So I would say those kinds of things relate to education and support. We also, I think for the whole time we've been in existence, we've also funded FTD research ourselves. So we have researchers that we accept grant applications, and we're funding research that focuses on FTD, which includes PPA-related research, either in terms of basic science, treatment or interventions, or caregiver issues. We provide education through webinars that we offer, and we offer, I would say, at least 10 to 12 of those a year. We also have started to do advocacy. This is just a quick subset of some of our family and community and persons with FTD resources. Again, the helpline listed at the top is one way people can have direct individual contact with us no matter where they live in the country. We have a general website. We have a website specifically focusing on communicating with kids and teens. What is this thing called FTD that's impacting a loved one? How can you better understand that? It's not because of you. These symptoms are because of the disease. We have a number of publications. I'll just highlight a few of those. The Doctor Thinks It's FTD, Now What? Is a guide for newly diagnosed individuals. What About the Kids is for parents in terms of better understanding how to support and educate kids in families that are living with FTD. There's a guidance booklet specifically on the genetics of FTD, and then a booklet that helps to support people around the loss of during the FTD journey. Excuse me. We also each year have some gracious donors that provide AFTD with money for grants. So we have a quality of life grant to support an individual with an FTD diagnosis to provide funding to support something which, would improve the quality of life. So that might mean money to support building a ramp, or money to support some kind of adaptive piece of equipment, or a class within the community. It can kind of be a broad type of request. Our grants are typically, in the vicinity of $500. So clearly, it's not going to support a huge building project, but it can be something that goes towards something. We also have grants for primary caregivers who live with a person with FTD to provide some kind of a respite service, whether it's care within the home, whether it's adult daycare, whether it's temporary respite outside of the home. And then finally, we do support people to travel to our annual conference, which I'm about to talk a little bit more. So each year, AFTD does a national conference somewhere in the US, and this year it's going to be in Denver on Friday, May 2nd. Clearly, you're in Virginia, so Denver is just not a 2-hour drive for you. The conference is offered in person, but also virtually. So we have over 1,000 people that register for our conference virtually, and they're able to view many of the same sessions that people are experiencing in person. So I would encourage you, we currently don't have that information on our website, but if you don't get information from AFTD, you could go to our website to sign up to get on our mail list and get our newsletter. Or you could just simply wait till January or February of 2025 and go to our website to see how to register for the conference. It is, I think, very valuable. And in fact, one of the recorded webinars that I already mentioned that I'm going to highlight again was a presentation at last year's conference in Houston. Below that, you'll see that we do have, I mentioned the support groups. You can go to our website website at this link and find out where local support groups are offered. I believe, Melissa, one of the local FTD support groups in your area is led by you. Is that accurate, or is that a mistake?
No, we do have one, but I have Nina leading it right now. She's
Okay,
my partner. So yes,
okay,
we are the one in the area that
okay.
provides the FTD support.
There are also other types of PPA support, and I'll talk about that in a moment. So these are some printed information pieces with links to where to find them on our website. I'm not going to go into those in any depth, but they're here. And I believe, Melissa, we sent you the PowerPoint. And so will you be able to share that with the audience?
Yes, we will share the PowerPoint. And someone did ask if you could put the link in for the speech pathologist, the YouTube link into the chat.
That is next.
All right, there we go.
So here is my handy dandy list of what are the three main primary progressive aphasia recorded web trainings that I think would be of value to this audience. And that first one is, in fact, the Maya Henry presentation speaking on approaches to treatment from last year's conference. So Maya Henry is the director of the Aphasia Research and Treatment Lab. As you can see in her, the letters after her name, she's a PhD speech and language pathologist and a leader in the Department of Neurology at the University of Texas, Austin. She does like one of the best overviews, and also then talks about some strategies and approaches that speech language pathologists can use to better support, to better assess and better create individualized plans for persons with PPA. So that, in my book, is the award winner. Below that, Dr. Darby Morhard and Dr. Emily Rogalski, who at the time of this recording, and I think this is about a year old at this point, but they were both at Northwestern University, and Northwestern is another location across the country that has real expertise in primary progressive aphasia. Dr. Marcel Messelem, who is an internationally known, expert in PPA. I think the center at Northwestern is named after him. And he actually, October 31st, we will be offering for healthcare professionals, it's going to focus on diagnosing PPA, and will specifically provide continuing credit for social workers, nurses, psychologists, and doctors. So it might be of interest to families and persons with PPA, but it's really going to be designed for speaking to healthcare professionals about understanding and diagnosing PPA. It's not up yet on our website. Again, you can sign up and we'll get you information, or it will be posted on our website sometime during the first week of October. These are some other support options. So AFTD in the fall and in the spring is now offering a 6-week psychoeducational support program for those newly diagnosed with PPA. So it's for the person with PPA that is relatively new to that diagnosis. It's a Zoom support group, so it's not in person. And if people want to find out more about that, like when the next group is happening and to get on the list, they would call the helpline number or contact the helpline at the bottom. We also have a number of in-person groups, regional Zoom groups, and national support groups. There is a national Zoom support group for caregivers that focuses on the language variants of FTD. There is a waiting list for that group currently, but if someone was interested in finding out about it, getting their name on the list, or possibly learning what some other supports might be, again, you would call the helpline. For those of you that are healthcare professionals, we have some specific resources that we create each year. I already mentioned that we periodically offer continuing education credits for live programs. We're in the process of creating an on-demand asynchronous program. That first program is going to be focusing on BVFTD, but we hope to have more on-demand. You go to the website, you can watch them anytime and get credit programs over the next couple years. We also put out a regular e-newsletter called Partners in FTD Care for healthcare professionals. The Partners in FTD Care link here will take you to the website where you can look at the specific resources or the specific issues and then select one based upon the topic. We do have a few of those that are specifically on primary progressive aphasia. I'm going to close out by saying, or the main topic of my final few slides is really going to be, the good news is there's a lot of research taking place now, more than ever, specifically around the FTD disorders, some of it being primary progressive aphasia specific. I don't think I mentioned this. It's a mistake on my part. So currently, there are no FDA-approved treatments specifically for primary progressive aphasia in terms of being disease-altering, and there are no symptomatic specific treatments for PPA that are approved by FTD, so approved by the FDA. But this is where a lot of work is taking place. So research to really find and confirm biomarkers that could be used to identify, let's say, blood-based biomarkers that a person has primary progressive aphasia or another FTD disorder. Disease-altering treatments which stop, slow down, or reverse the neurodegenerative process. These are all research studies that are taking place, and you can find out more about research studies by going to the FTD Disorders Registry, which is a sister organization with AFTD, or going to the AFTD website and then clicking on research and research opportunities. And just to close out, I think I'd encourage you to share some of this information with your family members, with your coworkers, with your colleagues. The FTD disorders are not well understood in the general community. I think that, a year ago when Bruce Willis' family announced that he had an FTD diagnosis, it has created a groundswell of interest and questions all across, certainly across the US and around the world. But there are plenty of people that don't understand what primary progressive aphasia is versus just the term aphasia. So share the information. We certainly encourage you to help raise funding for AFTD and our mission. Consider potentially being a volunteer. And then also we have more and more volunteers who are signing up to be advocates, who are working to educate legislators about the challenges of people living with or caring for someone with an FTD disorder. And at that, I will stop.
Great. We got from George, who asked the previous question. Thank you for trying to clarify. I was told that aphasia is not a suspect in verbal slurring that started 18 months post-stroke, just trying to learn more. Um, so that was his response.
Okay. Yeah. Yeah. And I'm not an expert actually in all the symptoms of that sort of generalized term of aphasia. So maybe that's why I hemmed and hawed, but I'm glad you felt that was a helpful response. Is there anything else you want to ask Melissa, or
I don't think there's any other questions. You did such a lovely job sharing all the pieces, and how to communicate with someone who is going through this. I did want to share with Insight, for those of you on and aren't familiar with us, we do lots of online, hybrid, and in-person classes. And I do want to share that next Tuesday from 11 to 12, we will be in Alexandria. We have a primary progressive aphasia memory cafe for the person with the diagnosis and their loved one. It's an hour to spend together to meet each other and do some fun activities. I'm the one who leads it. I'm a rec therapist by trade, and I had started this last year. And we took a break for the summer and we're starting back up. So you can go on our calendar or do the QR code here at insightmcc.org/events. And go to next Tuesday and you can sign up for it. We'd love to have you there with us, and to build this group, so that they have a place where they feel like they're with their own people and can engage in some things and give you a little break as a caregiver and meet some other caregivers that you can relate to. So I wanted to share that, but please feel to reach out to me at any time if you have any questions. And we have other presentations that AFTD has done for us that are saved under our webinars, as well. I did want to ask one question for you. The resources you were sharing with us, there is a resource that NIH just redid. Were you guys a part of that?
I was not, and so I'm not aware. So there was a resource that NIH just did or updated specifically on primary progressive aphasia.
On FTD.
Oh, on
It's,
FTD.
yeah.
So someone at a level higher than me might have been involved in terms of, input for that or being part of a group around a table for that. But I'm not aware of that. I hope we were involved in it.
I know, right? So if
Um,
anyone listening is interested in that, feel free to reach out to me and I can get you the links for that. But it's through NIH. They have free publications and they specifically have one for FTD, which is lovely. So
And I'll say, Melissa, since I think you're going to share information with me about a few things,
yeah,
I would love you to share that resource with me,
awesome. Awesome.
because
We'll
then
do.
I can do a deeper dive to find out whether it's something that we were involved in or not, and then also take a look at it to see what I think of it.
Yeah,
So good to know.
absolutely. Well,
I just want to say thank you to everyone. It's been a pleasure to really share information with you. Hopefully you learned a little bit more about how AFTD might be helpful to you or to a family member or to someone you provide care for. And also I just wanted to say, because I used to work in activities, I just want to put a plug for the Memory Cafe. It's, I think for people that are together and, for a caregiver, a care partner, and a person with PPA or other neurodegenerative illness, sometimes it's amazingly valuable to have something to do together that's not going to focus on the challenges or the issues, but a guided experience that really focuses on fun and involvement and creativity. And so if I was closer, I would come to your Memory Cafe, Melissa,
if you're
and
ever
be there.
visiting, feel free to join us.
Okay.
Um, well, thank you so much, for being with us. We greatly appreciate it. Reminder, this is recorded. It will be on our webinars, and we look forward to having you guys next month for our next topic. So enjoy the rest of your week, and we should have this posted within the week for you. Bye, everyone.
Bye-bye.